Progesterone is called the pregnancy-protecting hormone. When levels are low, the pregnancy may struggle, sometimes silently. What is progesterone and why is it important? Progesterone is a hormone that helps the embryo implant properly, keeps the uterus relaxed, prevents early contractions, supports early placental development. In early pregnancy, progesterone comes from the ovary and later the placenta takes over. Symptoms of low progesterone. Low progesterone may cause vaginal spotting or bleeding, recurrent pregnancy loss, lower abdominal cramping, back pain, short luteal phase before pregnancy, that stops progressing. Some women have no symptoms, only blood tests reveal it. Risks of low progesterone. If untreated, low progesterone may increase the risk of chemical pregnancy, miscarriage, implantation failure. Preterm labor. In some cases, early diagnosis makes a huge difference. How is low progesterone treated? Doctors may prescribe progesterone tablets, vaginal suppositories, or injections, regular blood level monitoring, continued support until the placenta fully takes over. Progesterone support is safe when prescribed correctly. Low progesterone doesn't mean you can't have a healthy pregnancy. It means your body may need extra support. Follow for daily pregnancy safety and awareness videos.